You are welcome once again to another episode of your favorite program, Blood Talks, the science of what flows through you. Now, last week, we were discussing a very important true life story of a couple whose baby came down with sickle cell disease, and the husband was supposed to be hemoglobin A and the wife AS. After a lot of controversy, we were able to resolve that the baby actually belonged to the husband. Now, in today's episode, we would like to examine this issue of thalassemia. Now, I'm sure you must have heard about it, and if you have not heard about it, it exists. It's not a myth. I'll be discussing more about sickle cell in my next video. And in that video, I would like to examine why sickle cell patients present differently one from another. Why some have more frequent crises, some have more prolonged periods on intervals without crisis. We will discuss the reason why in our next video. But for now, let's look at this thalassemia that we all think does not exist. Now, I must tell you that researchers have found, including researchers from Ibadan, Rivers, my good friends, Kotila, Omoti, even myself, a group of my researchers have found that the prevalence of carriers of thalassemia beta in Nigeria is as high as 26%. Wait, I will explain to you. Now, when I say thalassemia is a disease, a genetic disease,